What is meningitis? Meningitis is a rare infection that affects the delicate membrane called meninges. So, what is meninges? The meninges are three layers of protective tissue called the dura metal, arytenoid metal, and pia metal, together with the cerebrospinal fluid, enclose and protect the brain and spinal cord. Dura metal is the most superior of the meningeal layer. Its name means hard mother in Latin, and it is tough and inflexible. This tissue forms several structures that separate the cranial cavity into compartments and protect the brain from displacement. Meanwhile, arytenoid metal is the middle layer of the meninges, and pia metal is the innermost layer of the meninges.
Now, let's see the causes of meningitis. Bacteria and virus are organisms that can infect the meninges. When a virus infects the CSF, it is called viral meningitis. When bacteria infect CSF, it is called bacterial meningitis. Viral meningitis is usually less severe and may need no specific treatment. Meanwhile, bacterial meningitis can be quite severe and may result in brain damage. For bacterial meningitis, it is important to know what type of bacteria is causing the meningitis. Antibiotics are essential in treating patients with bacterial meningitis. Now, let's proceed to the signs and symptoms of meningitis. The first sign is high fever. Next sign is vomiting. The patient also will severe headache. Then, followed by convulsion. Sensitive to light is one of the signs and symptoms of meningitis. Now, let's see who is at the risk of meningitis. Babies, adults, and smokers.
Now, let us proceed to the mode of action of meningitis. Firstly, viral meningitis. Second, fungal meningitis. And the third one, bacterial meningitis. Let's see what is viral meningitis. If you have close contact with a person who has viral meningitis, you may be infected with the virus, but you are not likely to develop meningitis. That's because only a small number of people who get infected with this virus will develop viral meningitis. Examples of viruses that cause meningitis spread in different ways are non-polio enteroviruses, mumps virus, measles virus, and also influenza virus. Fungal meningitis is not spread from person to person. Fungal meningitis can develop after a fungus spread through the bloodstream from somewhere else in the body to the brain or spinal cord, or from an infection next to the brain or the spinal cord. You may also get fungal meningitis after taking medication that weaken your immune system. For example, steroids or medications given after organ transplantation. Next, what is bacterial meningitis? Germs is the main cause for the bacterial meningitis spread from one person to another. But how people spread the germs often depends on the type of bacteria. People can carry these bacteria in or on their bodies without being sick, and these people are called carriers. Most carriers never become sick, but can still spread the bacteria to others. For example, mothers can pass Streptococcus and E. coli to their babies during labor and birth.
What are the treatments for meningitis? Viral treatments include bed rest, intake of plenty fluids, and taking over-the-counter pain medications. Fungal combination of specific antibiotics can treat tuberculous meningitis, but it can have serious side effects, so treatment may be deferred until a laboratory can confirm that the cause is fungal. Bacterial. The treatments are intravenous antibiotics and corticosteroids. It depends on the type of bacteria causing the infection. Broad-spectrum antibiotic is recommended until the exact cause of the meningitis is determined. There are a few suggested drugs to treat bacterial meningitis. A A beta-lactam antibiotic inhibits bacterial cell wall synthesis, resulting in bactericidal activity against susceptible microorganisms. It is the drug of choice for syphilitic meningitis. Ceftriaxone exerts an antimicrobial effect by interfering with the synthesis of peptidoglycan. It is an excellent antibiotic for bacterial meningitis. Aminoglycosides inhibit protein synthesis. In meningitis or gram-negative meningitis, it must be administered intrathecally because of its poor CNS penetration. Vancomycin is a glycopeptide antibiotic that is active against staphylococci, streptococci, and other gram-positive bacteria. It inhibits biosynthesis of peptidoglycan. Chloramphenicol is effective against gram-negative and gram-positive bacteria. It can be used as a substitute in the treatment of meningococcal infection in penicillin allergic patients. Trimethoprim sulfamethoxazole is effective against many albeit gram-positive and gram-negative bacteria, but its use in bacterial meningitis is limited to patients with Listeria monocytosis meningitis who have a penicillin allergy.
Hi everyone! As the saying goes, prevention is better than cure. So, let us see, what is the prevention of meningitis? Firstly, we should wash our hands. It's very important to wash our hands. Careful hand washing helps prevent germs. Also, we should educate our children to wash their hands often, especially before eating, after using the toilet, and also after outdoor activities. Next, you should cover your mouth when you have the urge to cough or sneeze, because bacteria and virus of the meningitis will eventually spread through coughing and sneezing. Moreover, if you are pregnant ladies, you should always take good care with your food. You should try to reduce the risk of listeriosis by cooking meats, including hot dog. Furthermore, some forms of bacterial meningitis are preventable with the following vaccinations. For example, Haemophilus influenza type B HIV vaccine. Vaccine can also be given to younger children who are at a high risk of bacterial meningitis or who have been exposed to someone with the disease. It's approved for use in the children as young as 9 months old.